try to make a couple summary remarks. I've been taking some notes as I've listened to all of you. I love the show because I feel like I get smarter. We have smart people in the panels, and you help keep me smart. But I heard some of the things we heard earlier about the document imaging and how important that is. Collaboration came up over and over again. Interoperability came up over and over again. We talked about the massive amounts of data and the need to be able to process that data and process it with speed to have access to the data in a timely manner. Harmonization, we heard quite a bit about, just not the harmonization of data, but the harmonization of processes too. We got to make sure everyone's looking at the same thing in the same direction. We talked about some lessons learned too, and I think the one that really resonated with me was that human factor impact, that we can't forget we're really about the human factors and those providing the health care. The greatest technology in the world isn't going to solve the problem unless it's used and used in a way that is like to be used by those that are using it. We talked too about the disruptive influence that a lot of this has, that is disrupting the way things are, and that everybody has that resistance to change, but yet change is coming. So you need to manage that process and not forget that those processes also exist out there. Priorities, I heard over and over again, interoperability. Heard about the big off-the-shelf record program that's coming here. We heard shared services model being important. We heard about how important it is to coordinate with your partners and identify who they are and identify all the appropriate stakeholders. We talked about challenges of interoperability and speed and implementations of what I really liked was that issue of healthcare versus disease care, and in that point being driven home. Future, we see a time where it's going to be like always on healthcare. We have healthcare all the time, continuous improvement, and I like the gene mapping in genomics. With that, I want to thank all of our panelists for taking time from their busy schedule to share your thoughts with us. I want to